I'm Taylor. I'm a psychiatric nurse practitioner and a licensed therapist. And I think it's important to go back in time and kind of talk about how I've gotten to where I am today at Praxis. I started off my career as a licensed therapist, and so I went through school at Santa Clara counseling psychology program and worked in community mental health, and then went into private practice, and then have remained in private practice in my career. And throughout that experience of working as a therapist, I always wanted to know more. I was always curious about, you, the patient, and the medication side of things. And I started to have patients that we were stuck in psychotherapy. And we had tried so many things, and it got to the point that we had the conversation about psychiatry and including medication management as part of their care. And I was fascinated by seeing patients come back in 6 weeks saying, I can finally make use of the tools that we have been working on together for so long. And that was enlightening for me to see that happen before my own eyes, and started to become more curious about that world, which was outside of my scope. And actually, through the encouragement of Alejandro, the director of the patient care experience here at Praxis, and the nurse, also my husband, he encouraged me, go back to school, get more education. And that led me to becoming a psychiatric nurse practitioner, and went to Case Western in Cleveland, continued to practice psychotherapy throughout my time in school, and that heavily informed my experience as a psychiatric nursing student, and has also informed my entire experience since practicing as a psych NP. As a patient, I hope that you come away from our appointments with a nugget of something that feels valuable and actionable from every session. Even that, if that's not something that we address together in defining what that is, I hope that there is something lingering from every appointment that we have that you are taking away and incorporating into your life. I think that so much of medication management in managed care settings can feel quick and like you're just going to get a refill of a prescription and leave. And that is what I do not want from the care that patients that you'll receive with me at Praxis. I hope that it feels personal. I hope that it feels centered on you, but that you can still feel that there is a human that is invested in your experience. I would say for people who are nervous about taking that step to seek care and to reach out, that there can be a stepwise approach to this. If you're not comfortable starting with medication, that's okay. There's a lot of people that don't. There are a lot of people that don't even reach the point of wanting to or needing medication. But there's other things that we can incorporate in our treatment. We can start or stay with psychotherapy. We can add complementary approaches and supplements. We can also include lifestyle changes and lifestyle medicine. There's a whole host of things that we can try instead of or in addition to or before medication management, and really look at this as a stepwise approach that takes into account meeting you where you're at and what you feel ready for.